Hi, my name is Pat Snyder. I'm a dementia caregiver educator in Wake Forest, North Carolina. When my husband John was diagnosed in 2007 with Lewy body dementia, I can remember being overwhelmed. I wondered, is there any hope? Is all hope gone? I'm here to tell you now that our journey has ended. It ended in 2015, and since 2007, I have had contact with hundreds, maybe at this point even thousands of caregivers. And I have learned some things that I'm hoping will bring you hope. The first thing I want to say to you comes from Dr. Daniel Coffer, who is head of the University of North Carolina at Chapel Hill Memory Disorders Clinic and a member of the Scientific Advisory Council for the Lewy Body Dementia Association. So this is just not my opinion I'm sharing. This is coming from one of the world's experts in this disease. And this is what he said to me that I want to share with you. Dr. Coffer told me that Lewy body dementia is among the most complex of all the dementias. But it is the most responsive to the right care, to the right medication, to the right management, which we as caregivers provide. It's the most responsive of all the dementias. That sounds hopeful to me. And what that means is that there are medications out there that can help you. They have to be managed right. They have to be managed carefully. And there's some rules of the road for that I'll talk about in another video. But when you have a doctor who knows how to address these symptoms, it can just make all the difference. Also, the management of the symptoms, a lot of that falls right in our laps as caregivers. And knowing, teaching yourself, learning from others, the techniques that are going to work to make your journey more gentle is a big, big deal with Lewy body dementia. It's really a big deal with all the dementias, but especially with Lewy body because it is so complex and it is so variable. It is definitely not like Alzheimer's. So you're going to have a lot of variation and you're going to have some symptoms that happen possibly early on that you would not have with the other dementias. Learning how to manage that, learning what works and what doesn't, can make an enormous difference. So I'm hoping that this hopeful message can motivate you to want to learn those things and become a Lewy warrior. I always like to say I hope you'll turn in from a Lewy worrier into a Lewy warrior and become an expert on how to manage this disease. The second thing I want to say to you, which, I wish I had known for sure at the beginning, is that almost all Lewy body patients are going to know you right up until the end. They're going to know their loved ones. Now, there may be moments and times when there's confusion about who you are. There may be times where there's forgetfulness. But this is not Alzheimer's. You're not going to have a progression that goes down, 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 and memory is lost totally. Memory will be impacted in some ways. But I know very, very few people that I'm aware of who've passed away with Lewy body dementia who did not know their loved ones on the day they died. That should bring you tremendous hope that you are going to still have that connection. It won't be the same as it's always been, but it will be there. It won't be gone, most likely, with Lewy body dementia. I hope that brings you hope and just a comfort in knowing that you're not dealing with Alzheimer's here. This is a different animal. Couple of tips before I close the video off. If you can find the right doctor, it will give you a much more gentle journey. And by the right doctor, I mean either one who knows how to manage this disease very well, is confident in it, and really is aware of what is recommended by the Lewy Body Dementia Scientific Advisory Council. And you can find this information on the LBDA site. Look especially in the professional section for treatment. And there is a wonderful book called Managing and Diagnosing Lewy Body Dementia, or Diagnosing and Managing Lewy Body Dementia, which you should order from the LBDA online. There's just much you can do to manage these symptoms, and you should not accept from any doctor a fatalistic approach of, well, you know what, it's dementia, there's nothing you can do about it. That is simply not the case for Lewy body dementia, people. There are things you can do. Now, every patient's different, and they're going to react differently to different medications, and there is a hypersensitivity to medication. So you do need to be aware and teach yourself what medications should be avoided. And they may be a little different for each patient, but there are categories of medications that you'll learn about on your journey as you are taking care and learning how to manage your loved one with this disease. So you either want a doctor who knows how to handle LBD well, or you want a doctor who is humble enough to learn, who recognizes and respects you as a knowledgeable caregiver, who will listen to you and really take to heart the questions that you ask and have meaningful, informed conversations with you as you're helping him to manage this disease. The other thing I want to say, the other tip I want to give you in this video is please avoid ERs and hospitals when you can. 25% of the dementia patients in general who enter an ER or who enter a hospital, 25% of those patients come out with the same baseline that they went in. The rest of them usually aren't doing as well as when they walked in the door. So if you can avoid going to an ER, you have to think, I'm in a new normal now. I need to figure out something I can do. Maybe I can handle this situation here at home. Avoid the ER, avoid the hospital if you can, avoid those normal tests like colonoscopies that you would have done before. You're in a new place now, and you need to think differently because your loved one with Lewy body dementia, especially because of their medication sensitivities, can be very, very damaged by going to the ER and the hospital. I call that the most dangerous place on earth for an LBD patient because so many things can be done in the name of doing good by an uninformed doctor, somebody who just doesn't understand how to manage an LBD patient. So I want to remind you again of the good things. One, they're going to know you. They're going to know you. I can almost guarantee it. It's not 100%, but it is very, very high percentage that they're going to know you and your loved ones to the end. And this dementia is the most responsive of all of them to the right treatment and the right care management, which I'm sure you're learning how to do now because that's why you're watching this. Take care. Remember you're doing God's work and hang in there. Bye-bye.